growing kidney disease cases in local children worries Bali's medical professionals. Concerns over the increase in incidence of renal illness in young children have been officially expressed by doctors in Bali. Since August 2022, 17 children have been hospitalized due to an unidentified renal ailment, according to doctors. Tragically, 11 children have passed away. Reporters were informed by Dr. Ioman Gidanum, the head of the Bali Provincial Health Office, that study is continuing to determine the cause of the puzzling kidney ailment and what can be done to stop the number of cases from increasing. He has hypothesized that without a prescription from a doctor, parents have been giving their kids medication to treat common illnesses. He proposed that renal illness in these cases may be brought on by the incorrect, unprescribed drug taken in an unknown amount. He mentioned that doctors in the Gambia in West Africa have seen a similar phenomena. He advised parents to take their children to medical institutions for treatment in order to receive the proper medication and attention tailored to their child's condition. Only take medications that are provided to you by medical professionals or staff at a facility. He asked parents and other adults to forbid giving their kids any medication that wasn't obtained from a licensed pharmacy. He mentioned that these occurrences of renal illness may be brought on by a children's cough drug that is thought to be spreading throughout Indonesia. Reporters received confirmation from Dr. Anum that doctors in Bali are currently on high alert for signs of pediatric renal illness. He noted that all children who enter through the door are subjected to early detection symptom tests by physicians in collaboration with the district and city health offices, hospitals, and clinics. Even if a youngster visited the clinic for a different problem, he continued, if any early signs of kidney disease were found in them, they would be promptly sent for treatment. Since this is a novel issue, only a pediatrician team at Professor Ngora Hospital has the necessary expertise. Dr. Anum noted everything is handled by a team of pediatricians at Professor Ngora Hospital. Dr. Anum asked parents to closely monitor their kids' toilet habits and general health via reporters. He stated that if children show signs of a cough or cold together with decreased urine production, caregivers must take them to the doctor right once. Dr. Agustin Girisanjayaputra, the head of the pediatric team of Professor Ngora Hospital, underlined Dr. Anum's call for parents to pay close attention to their children's health and refrain from giving them medication unless a doctor has recommended it. According to him, most patients who come in have severely impaired renal function and are in a very fatal position. The glomerular filtration rate, GFR, in healthy people is more than 90 milliliters per minute per 1.73 square meters. Already, they are below 15 milliliters per minute per 1.73 meters. He noted that most of the 17 patients brought to the hospital with corresponding symptoms were younger than 6 years old. Unfortunately, 11 of the patients' ailments were too serious to be rescued, and many had to undergo dialysis. 5 patients, according to Dr. Putra, were able to be rescued after extensive medical procedures, and they are still receiving outpatient treatment. One 17-year-old kid is still receiving life-saving care at the hospital. Looking at the issue on a national scale, the Indonesian Ministry of Health has informed the World Health Organization of suspicious cases of acute renal illness. As of October 14, 2022, 152 pediatric renal disease cases had been reported in Indonesia. The Indonesian Pediatrician Association will keep looking into the problem even if the reason is yet unknown.